Hi, I'm Dr.Umang Kothari, a plastic surgeon and director co-founder of the Hair and Shape Clinic, Mumbai. We help our patients to achieve realistic aesthetic results in the most natural way by our knowledge of science and art. Welcome to the Hair and Shape Clinic.
Thank you, I'm Natalie.
Hi Natalie, yeah. So why are you here and what are we looking at today?
Well, I previously had facial feminization surgery and it's left me with a very high hairline.
Okay.
So I'd like to try and lower the hairline a little bit and maybe bring it around the side here.
Okay.
Just so I can wear different hairstyles.
Yeah. And when was your FFS was been done? That was
the FFS was done 2 years ago.
2 years ago.
Yeah. And then recently I had a little bit extra touch-ups. Yeah.
And that was how many days back?
That was 1 week ago.
Oh wow!
Yeah.
Oh wow! So you are healing well after that? You are recovering well?
Yes.
Any other problems for the post recovery time? Nothing.
No. All good.
Yeah. And what about your recovery 2 years before when you had FFS? It was smooth, no problem?
It was smooth, yeah. Good recovery.
Yeah. Can you tie your hair on the back side?
Sure.
So we are looking for the changing the male pattern into the female pattern. That's the beauty of hair transplant, and in which we are measuring the central line, the lateral end of an eyebrow, and the mid pupillary line. So basically there is a concavity which your two triangles are going inside and we are trying to convert into convexity. I'll show you how I'm planning.
Okay.
And we are going to put a high density hair transplant in this patch. It will be covered in a span of, I would say, 6 hours.
Wow.
Yeah.
Okay.
Yeah. And again, open up your, we'll discuss this thing out. Can you see your hairline?
Yeah. Oh, yes, I see.
Yeah. On both the sides. Yeah, you're happy with the hairline?
See, yeah, it looks great.
Yeah. So in Trans HT, the most important part is the patient's expectations. Now, since we are going to convert it into a female pattern frontal hairline, there are various female pattern frontal hairline, and every patient has a different expectations as per their look. So there can be a different frontal hairline. Of course, this is going to be wavy. It's not going to be straight. It's going to come forward, backward like this. Some of the patients, they want a hairline which goes like this. I think Indians, when I operate on Indian patient, they rather go with this kind of hairline in which the forehead becomes more narrower when we put more hairs here. But as far as whites are concerned, I think they are more happy with this hairline because it's more natural to them. And most of them are post FFS, so they don't require their forehead to be that much narrower. And of course, when we plant this, the requirement of graft goes on a higher side. So the duration of the surgery goes on the longer side.
So what angle will you put the hair in so that it matches?
Yeah, it's again a very valid question, because it's very much important to see your natural hair angles and to follow the same angulation. If I can do with this angle as per your natural hairline, as I go on the lateral side, I have to be more acute with the skin so that it fall back and it doesn't pop out on the sideways. Yeah.
I see.
When I'm operating the scars, I would rather put my hair into the deep tissue because the scar doesn't have a good blood supply. Or I try to keep my hair through the scar into the normal tissue. So when it grows through the scar, but the base is somewhere in the normal blood supplied area. So it grows as a normally. In the scar tissue of trying to implant, then there's a less chances of survival.
So I've talked to the doctors. They have done all the markings, shaved the back of my head, and everything's ready to go. Everything's ready. I'm just going in for the surgery right now.
Most of my patients, they have multiple surgeries like top, bottom, and the face. It's very much important when you place them on a very in a prone position to support all the implants in the body, because we don't want, especially if there's a new implant, we don't want them to migrate. So again, a very important point when we are doing a hair transplant in trans women. So I have started giving the local anesthesia. You can see the syringe, which is a 30 gauge needle, and there is a very minimal discomfort, I would say, rather than pain.
I'm feeling good. Yeah, there's very minimal pain.
Okay. Excited?
I'm very excited. Yeah, I can't wait.
So we are done with the transplant, and how was the whole experience?
It was really good. Really
On how discomfort or the painful?
slightly.
Slightly.
Not much.